My name is Dr. Tasneem Yamani, a healthy aging expert and geriatric practitioner. And we are talking about healthy aging and eating well and maintaining healthy daily habits. Nutrition is protection, and malnutrition is often missed. So, when we're talking about healthy aging, nutrition is one of the most powerful and most neglected pillars of healthy aging. In geriatric medicine, we say that what and how we eat will determine how well our body is going to age. As people grow older, appetite is often reducing, but nutritional needs are not. Now, with this mismatch, many people are at risk long before anybody notices. And one of the biggest myths that I've come across is malnutrition is only about being thin and skinny and underweight. But medically, this is not true. Malnutrition means that the body is not getting enough of what it needs to function. And this can even occur in an underweight individual, an overweight and obese individual, or even a normal weight individual. So that is why in geriatrics we say malnutrition can exist at any body size. And because malnutrition has serious consequences, including things like falls, infections, slow healing of wounds, muscle loss, hospitalization, and an increased mortality, we want to actively screen for it. Now, screening for malnutrition is actually a relatively simple, quick, and evidence based method, and it should always be done in every adult over 60, people who have chronic illnesses, after a hospitalization or a brief illness, with people who have unintentional weight loss, when appetite starts getting reduced, or when mobility and function also declines. In geriatric practice, we want to use validated tools that will look at these parameters such as recent weight loss, ability to eat, illness burden a patient has, the functional status they have, the changes in the appetite, and recent weight loss. Screening can be done by doctors, nurses, nutritionists, community health promoters, and even caregivers when they are trained on how to use the screening tools that exist, because early detection prevents serious declines. Another critical point is that nutrition is affected by many body systems. It's not just the stomach, and this is often ignored because as we are aging, dental problems will affect chewing. Saliva is reduced, and this affects our swallowing. Vision problems affect food preparation. Hand weaknesses and arthritis or muscle loss will affect feeding. Things like dementia affect the ability to eat. Gastrointestinal changes will affect digestion and absorption of food. Medications can reduce appetite or cause nausea. So, when these issues are not being addressed, people are blamed for not eating enough or being difficult, when in reality, the body is struggling, actually having a problem with eating well. There is also an important aspect that we forget. Sensory changes that affect our nutrition is the loss of taste and smell sensitivity. So, scientifically and biologically, as we are aging, the number of taste buds will be decreasing, and how the nerve signals from taste and smell receptors also becomes weaker. Of course, medication and chronic inflammation further cause blunting of these senses. So this will lead to food tasting bland and like rubber. It also leads to reduced appetite and enjoyment of food. This is not mental or psychological. It is actually happening at a biological level. But good part is the brain is still responding strongly to other sensory cues. So we can support and enhance appetite by enhancing texture and temperature contrast of the food, using aromatic spices and herbs to enhance natural flavors of the food. Improving the visual appeal of food, a more colorful plate actually encourages appetite. Encouraging shared meals and pleasant eating environments. Sight, smell, memory, and social interaction can stimulate appetite even when taste is declining. Protein remains critical in healthy aging. Evidence shows older adults require higher protein intake to prevent muscle loss, immunity, and recovery. When we have a protein deficiency, we can lead to a lot of muscle loss, weakness, poor balance, increased falls, reduced immunity. Now, I'd like to talk about supplements because it is an area full of confusion. Supplements are not a food replacement, and not everybody requires supplementation. You do not need to supplement with multiple pill boxes where your breakfast is 50 different tablets, which are different supplements, when you're eating adequately. Evidence supports supplementation only when there's a documented deficiency, when there's a reason or poor absorption, when there's an increased medical need of certain supplements. Or when we are unnecessarily supplementing patients, we are increasing the risk of drug nutrient interactions, we are increasing side effects, we're increasing the risk of polypharmacy, financial burdens. So, when I talk about polypharmacy, it is a major risk factor for many things that lead to complications in geriatric patients like falls, confusion, kidney issues, hospitalizations that are unnecessary. Now, more is not always better. Healthy aging nutrition is about screening early, addressing barriers to eating, prioritizing real food, using supplementation wisely and selectively. We want to remind you that aging comes with a loss of appetite, yes, but malnutrition is not about how you look, it's about how you function. Eating well as we age is not about restriction, it's about support, adaptation, and nourishment that respects the aging body.